Hi, I'm Dr. Paul Adenuga. I'm a plastic, hand, and peripheral nerve surgeon at New York Plastic Surgical Group. The first inkling that I was interested in plastic surgery, despite what I thought it was about, over the years, just kind of watching how impactful it is for patients from a reconstructive aspect, from a hand surgery aspect, from a nerve surgery aspect, from like an aesthetic aspect, is just, to me very profound, honestly. I don't know any other specialty that's like quite as, fun and complex and fulfilling as plastic surgery. Like there's nothing quite like making a patient just feel happy and complete. And I say that a lot. I'm like, no reward is ever going to be as great as how you make patients feel. Safety is number one, two, three for me. And I think most surgeons, that's true. I'm pretty conservative in what I like to do to patients. I'm always trying to dial back what patients are looking for, especially if I feel it's unsafe, because there's almost a need in this day and age to be aggressive, to be maximalist, to get like this knockout result. But with that, and what I've observed is if you continue down that trend, you're gonna have a lot of complications. And for me, it's more important to get really good results with minimal to no complications. So for me, I tend to take a very conservative approach to surgery and just taking care of patients. So you got to listen to the patient fully, understand their perspectives, and it's not just the physical, there's the psychological, there's the emotional, and that's something I'm very attuned to, patients' emotional desires or why they're really attached to something, a result they're looking for. For me, as long as the patient feels like they were listened to, they were heard, they were understood, and they got a good plan that they can kind of, proceed with, that's really a good patient experience. When patients walk through the door, I want them to feel like they, number one, are talking to someone who's actually very knowledgeable, who really is here to understand and provide really good answers to their concerns and questions. And I'm a very detailed person. I like to extract as much detail from the patient as possible because I feel like you make best decisions with maximal detail. So I want that feeling of safety, of openness, of, kind of no fences, if that makes any sense, to really kind of release that information. An advice I would give to patients considering plastic surgery for the first time would be a few things. Number one, really understand why. Your why, as with a lot of things, is probably one of the most important things. That really kind of drives your motivation or lack thereof. Just do your homework. There are so many reasons beyond vanity. As a matter of fact, vanity is often not even a factor for most patients to pursue plastic surgery. It is a very essential part of self-care, not something that you should consider frivolous. And also, along those lines, it's not something you ever want to do for someone else. You 100% want to do it for you. Plastic surgery has been a very, very fulfilling and rewarding profession and specialty so far for me. Early in my career at New York Plastic Surgical Group, I am more than happy to see patients for whatever concerns they may have. And I do see patients in the New York City and Long Island offices.